They say that kidney stones, or passing a kidney stone, is the only thing that's the same or worse than delivering a baby. Having passed a kidney stone, I can tell you that if that was the pain you have with having a baby, I would have only had one. There would have never been another one. Luckily, I've only had to pass one kidney stone, and I'm hoping that doesn't ever happen again either. But this is something that kids can occasionally have. It does tend to happen a little bit more if you have a family history of it. The symptoms, although sometimes a little different in very small children, are pretty much the same as what you're going to see with an adult. Extreme pain in the back, and it can be shooting. It can shoot down into their groin. A lot of times they'll have painful urination. They may even be passing blood. That blood is as the stone is passing through the ureter, it's scratching the wall and causing the wall of the ureter to bleed, and then you're seeing that blood in the urine. A lot of times they'll have tenderness to their back, just like a kidney infection, and so this is something we have to be worried about. To make that diagnosis, you come in for an exam. A lot of times it's going to look like a UTI, but we see blood, maybe not so much as far as white cells in the urine. It requires usually a specialized test where we do a CT scan where we look for stones. It's called a stone series. Sometimes, if the stone's mainly calcium, you might be able to see it on an ultrasound, but a lot of times it requires a CT. Once we have the diagnosis of a kidney stone, we try to get an idea of how big it is and is it going to pass on its own. We may flush out with lots of fluids and we may need some pain management. But once we have that stone, you probably need to be worked up, either by your personal pediatrician or by a urologist, where they try and figure out why you're passing that stone. Why are you building that? Is there some sort of abnormality? Sometimes we need to know what kind of stone it is, what it's made of. And then we may need to make sure that that doesn't happen in you again. Every once in a while, these actually require surgery to actually go in and try and take it out, but that's actually fairly rare. So the important thing to remember about a kidney stone is if you have a family history of it, always kind of keep it in the back of your mind. And if you have a kid that's screaming in pain and looking like they're delivering a baby, it might be a kidney stone. Anytime you have pain this severe, absolutely go see a doctor.